I go and pee and I take a little glass, and the first thing I do in the morning, I just drink it.
I drink my urine every morning.
I'll maybe put it on my skin, on my face, on my hands.
I bathe in my own urine every day. Whatever I've collected, because I always have these jars going, I just throw in my bath water.
I put it in droppers, I put it in my eyes, and my eyes are clear, my vision's clear. I put it in my nostrils. I have given myself enemas with urine.
I carry my own little bottle. This contains a little bit of urine and a tablespoon of water. I take a couple of drops of this mixture and I apply it under my tongue.
Where most signs say, please don't pee in the pool, ours is, please pee in the pool.
Stealing from the rain. Lost between the day.
If you're drinking your own urine, it's good to drink fresh urine.
The first part of the urine that comes out, you just let it go, so it doesn't taste so strong because the toxins are usually heavy. So they start underneath of the blood on the bottle.
The taste of urine is depending upon what you've had for dinner or your previous meal. If you've had a highly acidic meal, the urine is more salty and metallic. If you've had a vegetarian or primarily an alkaline diet, then the urine is almost neutral.
The better your diet, the better it tastes. The worse your diet, the worse it gets. When you take Coke, you drink Coke the day before, it will be terrible. So this is a good way of going into a healthy lifestyle because it really teaches you.
Some people say, oh, don't you chill it, put it in the refrigerator, or put ice and mix it with juice. I just drink it straight.
Many people even like the taste of urine.
It's recommended in taking the urine therapy that you only drink your own urine. You don't take anybody else's, unless it's somebody very, very sick, and then they would take the urine of a baby of their own sex.
The only thing that we recommend is that not to have any chemicals in the body, other drugs.
You really don't need a diagnosis if you're sick. With the urine therapy, you just drink your urine and it will cure it. If somebody is really sick, becomes a vegetarian, and starts urine therapy, I don't care what kind of illness they have, they're going to get well. And if they continue that, they're going to live a long, healthy life.
All over the world, throughout history, urine has been one of the most commonly used medicinals ever. In fact, probably more people have used urine than any other single substance in the history of the world for healing.
Ayurvedic medicine is the natural system of healing that evolved sometime around 3,500 years ago on the subcontinent of India. One of the earliest scriptures in the Indian tradition dealing with urine therapy was the Dharma Tantra. In this book, they refer to urine therapy as Shivambu. It has the name within it of Shiva, the god of destruction, making reference to the idea that urine therapy was seen as a tool for destroying and eradicating disease from the body.
Here you see Dharvantari. He's the father of Ayurveda. And he's holding in his hand a beautiful container. Okay? They said that this may be just to show us the fountain of health, that is the urine within ourselves.
Ayurveda presupposes that the entire universe, all things, both sentient and insentient, are composed of 5 elements, which they call the Pancha Mahabhutas. And those elements are known as space, air, fire, water, and earth. Urine is consisting of mainly the water element. The skin is considered a pitta organ, a fiery organ. For that reason, urine was thought of long ago as a potential way of treating different types of eruptive diseases.
The Creator, in His infinite wisdom, put the most powerful medicine on the planet Earth within the human being. That medicine is urine.
Hoy, Señor, te damos gracias por la vida, la tierra y el sol. Hoy, Señor, queremos
estamos descubriendo que Dios es tan grande, que estos cuerpos, dentro de nuestros cuerpos, tenemos agua de la vida, que está haciendo muchas curaciones hoy en día. Qué grande es Dios.
Se acepta el agua de la vida. ¿Ya? Para eso, pues necesitamos también meditar y ponernos a pensar. Como lo que ya María decía, la grandeza de Dios, como todo nos puso a nuestro alcance. Todo nos lo pone en nuestras manos para que tengamos nosotros salud.
Agua de la vida is the water of life, which is the other name for urine. I found out about this sister who was in Nicaragua, and she had studied there in a clinic in Nicaragua, this Urine Therapy, urine therapy, with a Chinese doctor. And so she was transferred later on to the Peak, so I invited her to come here and give a course. So she spent about 8 months with us, 1 day a week.
One of the best urine therapy books going is the Holy Bible. And not just in the Holy Bible, and people aren't going to like this because it's very controversial, but there's a whole school of thought that feels that Jesus Christ was talking about using urine. When he sat by the well with the woman, the way he was talking, you know, his little, he had to allude to it. He wouldn't come right out and say those things. And I know nobody, you get somebody who's way into Jesus, they're going to have a hard time with this, but I'm way into Jesus too. I think Jesus was an incredible person. But I also feel that he did urine therapy.
If you research Proverbs, it tells you there that you should drink out of your own cistern and out of your own well. And as you continue to research the sacred scriptures, they're always talking about the water of life. I would tell you that the water of life is the urine.
In India, they have whole hospitals. That's the only thing they do, just urine therapy.
Morley Safer was on television with the Prime Minister of India, and he made some sort of insult, said, don't you find it disgusting that you drink your urine? And the Prime Minister made Morley Safer apologize for having said something like that, because he just insulted a couple of 100 million Indian persons who utilize urine as a basic part of their regular daily hygiene.
In China, 3,000 years ago, the older Oriental men and the older Oriental women would drink the young boys' and the young girls' urine. And the reason for that is that, as we know, our urine contains everything, all the components of the body, so the young boys' urine was full of testosterone, which would keep a man young and vital and healthy, and the young girls' urine was full of estrogen, so this would help to keep the older women from aging and keep the collagen levels in their skin and so on.
There are inscriptions also in hieroglyphics on some of the Egyptian remainders, which basically say, be sure to drink your urine every day and don't tell the poor people about it.
Urine was used in ancient Rome as a washing detergent, and they used to collect urine in big stone vases on every corner of the road, and they would bring this urine to the city laundrettes. The Eskimos have used it, and some of them are still using it. Natives of South America have used it, and some of them still do. The Aboriginals were very well acquainted with the use of urine. There is evidence of nomads in the Middle East using urine as a health thing, but also as a washing method. They wash their bodies with either human urine or camel urine.
The Native Americans, they used it as a normal aspect for cuts and bruises, and also for the spiritual aspect. They used to send the people out for their journey, for the quest into the desert. You're not allowed to pick anything. You're not allowed to really live off the desert. You have to live in the desert. And of course, you used your urine for that.
It was used to a large extent as a beauty treatment for quite a while in 17th and 18th, 19th century France and Europe as a whole.
In Japan, urine therapy is also growing very fast due to a famous professor. He started working together with a pharmaceutical laboratory, making a product to make morning urine a little bit more accessible. What they did was sort of make a powder which you can mix into morning urine, and it gives the urine a sort of sweet taste.
今、4、5年前の調査では、だいたい200万人から300万人はやっておるというように考えたって、現在はもっと多いと思います。もう1000万人も2000万人にもなってると思うんですが、世界中で一番多くやられてるのはブラジルとかインドとか、あるいは中国とか、いわゆるその医療のあまり普及してない国々では、もうこんなありがたいものはないから、一つの村全体がやっておるところもあります。
Doctors, before they had glucose testing, the way they would test for diabetes would be to taste the patient's urine. And if it was sweet, they had diabetes.
In the early days, penicillin was a very expensive medication. I mean, now penicillin has almost become out of fashion, but at one time that was a life-saving drug and it was extremely expensive, available in a very limited manner. And people actually used to save the urine of the patients who were getting penicillin therapy to salvage the penicillin that came out in the urine and use it again for its medicinal properties.
Thousands and thousands and thousands of life-giving constituents are contained in urine, and they are being studied continuously. About 1,000 papers a year are written on urinary constituents.
Urine is approximately 95% water. Then about the other 5% are substances that are divided between urea and different types of protein substances and other types of chemicals that are the metabolic byproducts of the body.
There's all kinds of vitamins, minerals, amino acids, and just an abundance of wonderful nutrients for the body.
Urine is full of interferon, is full of interleukin-2, and these substances to produce pharmaceutically to put back into the body are extremely, extremely expensive. And yet we have these things with us all the time and they're free.
Every time you take a medication, for example, even like a simple aspirin or any other chemicals for whatever reason, some of them are processed by the cells and they're released in the urine. So in a day-to-day function, urine has many different components.
It's a misnomer to call urine a waste. The bottom line is that urine is made through the kidneys. As the blood flows through the body, it is filtered through the kidneys. It is done every minute of the day. The reason for that is that we eat and drink more than we need, essentially, in vitamins and minerals and liquids.
Urine, when it is first voided, is 100% sterile. Now, over time, bacteria will grow in it, but when it's first voided, it is sterile.
Urine is antibacterial, antiviral, antiprotozoal, which means against protozoal or against parasites. You can use basically urine for almost anything.
All it is like plasma. It's the same, it is plasma. I've injected it into my veins just as an experiment.
I had the opportunity once to actually compare the taste and appearance of serum from my own blood with my own urine. The serum is that liquid portion of the blood. It's not the red blood cells that gives it the color, but it's the portion that generally rises to the top of a test tube if you allow blood to sit for a while. And the taste of the serum and the taste of the urine are remarkably similar. And in fact, urine is the blood.
It is much simpler to work with urine than the blood to study exactly what's happening in a person's body. For example, if you want to isolate a factor that is important for tumor growth, you have two options. You can look at blood or you can look at urine. Urine has much less proteins and other factors that exist in the blood. Therefore, if you want to isolate a particular factor, looking in the urine is much better.
Urine is a blood byproduct. Your kidneys are part of the circulatory system. Your kidneys are not part of the lymphatic system. You see, the main purpose of your kidneys is to control the volume of blood in the body.
The Dynamic Kidney, Part 1.
The kidney, under regulation from other organs, other tissues, other hormones, regulates that constancy of the internal environment, and a byproduct of doing so is the production of about 1.5 liters of urine per day.
Most people are born with 2 normal kidneys. In each kidney, there are approximately 1 million filters. These filters are called glomeruli. They filter out the blood, which passes on one side of the filter. The extra salt and water that we take in passes through the filter, waste products passes through the filter, and all of this comes out in the final urine.
On a ballpark average, we make a huge amount of this filter, 170 liters. The kidney actually has to do a tremendous amount of work. It's filtering the water and electrolytes out of the blood. And of these 170 liters of stuff that it takes out on an average, all but 1 or 1.5 liter is reabsorbed in the system as it passes through the filter and the pipes and ultimately comes out into the terminal part of the kidney, and there is a tube called the ureter that comes to the bladder and out.
The kidneys, the remarkable homeostatic organs that help keep constant the volume and chemical composition of body fluids.
The kidney has been designed over many millions of years by powers far greater than us, and it's been designed in a fashion to help the organism, that is human beings, the most. If it were created in a fashion where it let loose of all kinds of valuable vitamins and nutritional products, it wouldn't have been designed very well.
What you're doing with the urine therapy is actually using it as a way to stimulate the immune system.
It works as a vaccination. It contains a whole bunch of antibodies and antigens, and it is sort of custom-made medicine for yourself.
What happens when you get exposed to a virus, your body produces an antigen-antibody complex. It comes through the bloodstream. When you have too much of that, it cannot go into the tissue, it comes out in the urine. When you take it back into your body, either through injections or through implants or even drinking it, what happens is that antibody-antigen complex will stimulate the immune system.
Antibodies, frankly, don't usually appear in urine. And I would be surprised if, in all the studies that I've looked at, there aren't too many diseases where antibodies appear in urine in sufficient quantity to be of any significance from a therapeutic point of view.
Many times an antibody is a marker of a disease, but not protective in any sense.
Antibodies are not usually used for treatment unless one made what are called monoclonal antibodies and produced them synthetically outside of the body in some kind of extracorporeal system.
尿を薬物として薬として使うんでなくて、体の情報源として使うと。その情報源を分析する機能が喉の部分にあるんだということが分かってきたわけです。したがって尿を喉を通すことによって病気の判定が行われて分かると同時にそれを治す自然治癒力が生まれるということがはっきり分かったわけです。
We had the Ebola outbreak in Zaire. The way it was put down was by taking the blood of the person who survived and basically injecting it into the person who had the disease. And that's the way they stopped the disease.
If you're visiting a country where most tourists develop dysentery, malaria, cholera, typhoid fever, what do I tell some of my followers? As soon as they get to the hotel, ask the healthiest looking bellboy for a drop of his urine. Because he already developed resistance against the microbes in the area. His urine is the best vaccine against the diseases that could affect tourism.
Urine should not be used from other people. So your own urine is the only one that is going to react with your immune system to give you the antibodies that you need.
どこでもどんな場所でも山の中でも海の上でも実行できるということなんです。世界大戦になってインパールのアラカンの山脈の中でたくさんの兵隊さんとかいろいろな病気にかかったけど薬は何もないというような時に
When Air Corpsmen or Army men or people were deserted or stranded, and they had no choice but to use their noggin to survive, and they were dying of thirst, they would do anything to stay alive or parch their thirst, even drink their urine, or to use the P word, they found out not only did they live, but certain other things happened, that maybe a sore went away or they weren't sick anymore.
I was in the army for about 2.5 years, and one way of surviving, because of what I was poisoning, was to drink our own urine. And we can survive for about 30 days just by drinking our own urine. So we don't let it go. We just drink continuously for about 30 days, so we had a chance.
And so there's no other food or water?
No other food or water, just surviving on plain urine.
We came into this world experiencing urine therapy because when we're in the womb of our mothers, the amniotic fluid is composed of our own urine.
The fetus grows and thrives and comes to full maturity in amniotic fluid, where the excretions from its own body are present. The concentrations, however, in the amniotic fluid are being constantly kept within a low range by removal into the maternal circulation and excretion through the mother's kidneys.
One of the problems with urine therapy is the fact that when, as children, we have been so indoctrinated that it's dirty, don't touch it, that when I bring it up to people, they're pretty turned off by the thought.
I just think it's something that's sort of kept under the rug. People just share it on a one-to-one basis. It's not something that people are going to just, come out and say. I mean, come on, we're talking about taking your urine and drinking. I mean, when you go into a bathroom, a public bathroom, or you smell old urine on the street, it's disgusting.
Human psychology being what it is, we resist change because there were so many forces telling us that this was not right, either because where it emanates from is a sexual or perceived as a sexual part of the body, and we've had so many years of entrenchment to the contrary.
If you would talk about golden shower and drinking urine in that context, it seems almost that that is more accepted and more accessible to people as well than drinking urine for a health purpose.
Guys used to joke around and tease me about it, and I would laugh. And one time, one of the guys would kid me, so I had put some in a glass, and this one guy had a weak stomach, so I drank it right in front of him, and he got really, keeled over, and he almost threw up. But so he wouldn't tease me anymore.
Some people think it is maybe smell bad or something. I used to keep urine on my head whole night, and it is not at all any smell, not at all, absolutely nothing.
The first time somebody drank whiskey, that smelled or tasted funny, or people smoking cigarettes, that tastes funny or smells funny, and it still continues to be real funny. And in comparison to so much of the garbage that people eat and ingest, urine is a drop in the bucket.
So now you talk about urine therapy and people laugh. Well, I got a question. If you're going to laugh, what part of it are you laughing at? If you're going to say it doesn't work, what part are you going to say doesn't work? That urine shouldn't be used? That it's quackery? Well, then you should sue today every doctor giving Premarin, because that's pregnant mare's urine. That's not even human urine. That's a horse's urine.
Premarin, if you break it out into at least two of the three parts of the word, prem, being pregnant, marin, mares. So Premarin, it's $1 billion product in the pharmaceutical business for replacement of estrogens in women who are postmenopausal.
So this is perfect for cloning. Women make a factor that is identical to Premarin. Many factors have been isolated from pregnant women urine, who have had many applications in biology, like blood thinners were originally isolated from liters of pregnant women urine. And that has provided a huge breakthrough for treating many different diseases.
I don't know any scientific basis for the beneficial effects of drinking one's own urine in terms of fighting any diseases.
Taking urine in order to replace substances that the body is using, with today's balanced dietary intakes, strikes me as not necessary.
As far as I know, most factors that are released in the urine are produced in such low quantities that they have no physiological function if you just drink urine. Furthermore, a lot of these factors are proteins. When you drink urine, the acidity of the stomach completely neutralizes these proteins. If they are chemicals which can be absorbed through the stomach, they are produced in such a low amount in the urine that you have to drink gallons of urines.
I have a container, plastic container below my toilet at home. And I take that and I pee in that. And then I take the syringe, the small ones, the ones that diabetic use. I fill it up with urine and I remove all the air from the syringe and I give myself a shot. And the muscle is intramuscular. Or I grab the fat tissue in my belly and I put it right in there. That is a universal vaccine against anything. And that application is being used to treat cancer here in the United States.
If you keep injecting urine intramuscularly, the factors in urine can cause more damage to the muscle because a lot of them are waste products and they can cause scar tissue formation. And in the long run, it can compromise the function of that particular organ.
What is coming out in the urine has to be coming out from your body. So in different form or manner, some part of your body, some part of your cells, some part of your tissue already has this component. So other than the fact that it may be either diluted out during the process of urine formation or concentrated during the urine formation, I can't think of the urine actually having a unique material or chemical that anybody can conceive of having medicinal property.
What is homeopathy? It is the dilution of an agent that produces disease into a certain amount that will not produce disease anymore, but will produce an immune reaction for your body that will give you the antibodies to eliminate the disease. So in the same way, if you take the urine 1 teaspoon and you dilute it in 4 spoons of water, okay, you mix it, you're doing a homeopathic solution. And that is the most potent to eliminate acute disease.
If it's a nuisance antiquity, we ought to know by now, beyond all doubt, whether it's beneficial or not.
Using urine therapy for both cancer and AIDS has shown really good results in at least some persons.
I'm HIV positive. I've been doing urine therapy for about 2 years after very heavy illness, many illnesses at one time. In fact, I was doing 11 medications a day. I just took all the pills and tossed them away and started doing urine, and I've gained like my 40 pounds back that I've lost. I haven't been sick a day since I've started, and I'm still doing it.
There have been reports, not necessarily in the mainstream medical literature, but not totally outside the mainstream literature, of substances, of compounds, of urinary peptides. These are urinary molecules, which in experimental laboratory settings have an anti-tumor-like effect.
The established conventional medical community is not particularly open to anything new. And any researcher, I think Brzezinski is a wonderful example of that, Stanislaus Brzezinski, who came out with the antineoplastin therapy, which of course is urine-derived, and has had nothing but legal problems with the FDA.
Federal prosecutors claim Dr. Stanislaw Brzezinski, who has drawn hundreds of patients from across the U.S., violated federal drug approval rules and defrauded insurance companies in dispensing his experimental cancer drug known as anti-neoplastons. The Polish-born physician discovered the compound in human urine and now makes it synthetically. He claims it turns off cancer genes by interrupting signals for cells to multiply. The government says he can't prove that. Brzezinski, the government says, thumbed his nose at FDA rules designed to protect the sick and made $40 million doing it.
We are trying to save their life, and against us are bureaucrats for whom their life means nothing.
There's no scientific double-blind placebo-controlled studies, which is the hallmark of good science and good medicine.
You cannot apply for experimental drug permit when something like urine is different with every person. When you have a drug permit, it is always the same drug. Well, urine is always different. Every person has a different urine. So every time with every person, you would have to apply for a new drug permit. So it's kind of, it doesn't fit into our system.
In this country, there have been a few doctors arrested for giving the urine injections in their office.
Clinical trials are very difficult to perform because there's always a placebo effect. And if people want to believe that they're going to get better by drinking urine, they might get better just from the placebo effect.
The placebo effect is normally 30%, so also if it would not work at all on a physical level, then still 30% of people would get better just by thinking it is good for them. What I've seen with urine therapy and what I've heard and read about it is that much more than 30% benefit from it.
Even if it is a placebo effect, who cares? You know, if somebody's getting well, I would much rather they get well from a placebo effect than putting a pharmaceutical poison in their body and killing their liver.
The problem with the medical field is that they usually are educated in one way. Okay, they all go to basically the same schools in the US with the same background of education, and what is taught is that urine is a waste, it's toxic. And I have people telling me when I drink my urine, I'm dead in 3 days. And of course, I drank it right in front of him, and nothing happened. And I was still alive years later.
The people who live the longest stay away from doctors. They hardly ever go to visit them.
The researchers themselves, they don't want to be badgered by their peers because they do something with urine. I think there will be a lot of peer pressure not to do it. It's much more hip to do something else, to work on drugs, to do, how can you imagine publishing a paper that you did something on urine? I mean, it will be the rest of your life. You will be that lady, with that study. Like with me, I have written books on urine therapy. They still call me the pee lady.
Doctors would not hesitate to give urine to every patient if it were medication. It again comes from the paradigm of acceptable theory and acceptable practice. Giving one's own urine, whatever the condition, if it's not attached to a drug, is not attached to their education. You have to understand who chairs the departments of pharmacology in medical schools. Pharmaceutical companies. Eli Lilly has a foundation. Tens of millions, hundreds of millions of dollars have gone into Eli Lilly Foundation. They then go to a medical school and say, we're going to give you X amount of dollars for a chair in pharmacology. And next thing you know, every medical student's coming in is learning about better ways of dealing with disease with drugs and certain drugs, certain classes of drugs, and watch if that doesn't tail itself back to some of the things Lilly is manufacturing. Nobody gives money for nothing, and nobody gives hundreds of thousands of dollars to fund these chairs unless they know that their kind of education that will benefit their products are going to get sold.
Doctors themselves have very little access to PR to publish their findings, to publish their research. And as a result, all of the wonderful documentation that's been done on urine therapy lies unread. And until there is some type of PR basically done on it, doctors are going to continue to ignore it just the way they did vitamins and herbs.
The diseases are rampant. Our physicians have failed us, and they don't know. All they care about is that index up in the stock market, and if you look it up, there's nothing higher than the pharmaceuticals.
In America, organized medicine generates $1.7 trillion a year. That's 15% of the national gross product of the United States. Do you think they're going to start teaching people that all they need is an enema to eliminate 100 diseases? You think they're going to tell everyone that a little urine is going to cure asthma? No. They'd rather turn asthma into a $100,000 disease.
Una amiga también me platicaba que dice que ella está muy contenta, muy agradecida también con el agua de primero, Dios y todo. Dice, con el agua de la vida, porque ella tenía asma. Y si ya los doctores le habían dicho que dice, iba a ser para toda su vida. Pero empezó a tomar el agua de la vida, dice, y aquí me tiene, dice, tan contenta, dice, tan, porque mi asma, dice, adiós.
If urine were to be a cure for something that they're making $100 million a year out of, they're going to be against it.
It is true that industry is driven by where the dollars are, and there's not much money in urotherapy, but I have a feeling that if somebody could prove it were effective, they would package urine in some fancy way that to make it, cost efficient for industry as well.
尿を飲ませることを一般にやると、医療として成り立たれないわけです。
I guess people have their own methods or ways to try to market the idea or make a business out of it. But I think basically it's not a lucrative money-making business. And I think except for when you take it to the level of what the medical world has done, and that is to take urine, which is big business, and turn it into pharmaceutical drugs.
I think people are going to actually be able to get money from donating their urine at some point as drug companies begin to appreciate how you can get growth hormone, insulin, all kind of active pharmacologic substances you can get from urine.
There's a company out of Utica, Michigan that has 10,000 porta potties. And they outfitted all the porta potties with a special filter. And in 1 year, let's see, out of 14 million gallons that passes through their porta potties in these filters, they extract 4.5 pounds of urokinase.
We look at urine as a source for a myriad of products, and these products are all accepted today. We're not inventing products. These products are all being used today in life-saving situations to treat patients. Every product that we look at has in excess of a $500 million market now. You can get the same proteins that we harvest by cloning them from your blood, or you can get it from your tears. Or you're not going to give me your blood, you're not going to give me your tears, but you love to leave your urine in a little green porta-john. And the things, and the cloning thing is, it costs too much money. These filters are what we use. We place these in toilets, and each one of these filters is designed for a specific resin. This is actually they're all the same in here. They're designed for certain types of resins. And this filter, I'd kiss it if I could, because it really works. We take this filter, place it in the urinal. Now you could leave it there, but most people would shoot to miss the cup. So by doing this, nobody's aware that there's a filter in there. Then in theory, there should be zero protein in the urine that's in the holding tank. The filter, you have to look at like a male and female connection, because what happens is you have the female spot on the resin and the protein comes down and is adsorbed on it. The trick is to elute the proteins that you want without damaging the other proteins.
This is the resin we have here, and the stuff that has come up now in the liquid form, we call that elution of proteins from the resin. And we are trying to filter this stuff, which is our proteins, that is being retained. There is a filter inside, and that's not letting those proteins go outside. What we get from here, a very small sample, it will look like this.
And that's just pure urokinase?
It's pure urokinase.
Today, pharmaceutical companies are only able to purchase 2 million gallons of urine annually, still creating a $500 million market. Whereas EOA, through Porta-John, annually collects 14 million gallons of urine. Once our filter system is placed into the portable toilets, EOA will be on the threshold of a multi-billion-dollar market.
Topical application of urine is one of the major ways that it's used. Probably more people use topical applications of urine than any other form.
You'll find a lot of mothers, when their babies urinate in their diapers, they'll take and they'll wipe their face with the diapers. Just makes the skin very soft and supple and keeps it very, very moist.
You get stung by a sea animal of some kind, or you're stung by a bee, you get a cut, a burn, or whatever. An easy way to take care of that situation would be to just urinate on your own injury.
If you have a burn area and you put it into a glove and you urinate in the glove, you are creating an artificial incubator for a new layer of skin to grow.
Different skin conditions, they don't even have names. And the people went to one doctor to the other, they cannot get relief. You put urine on there, you start to really soak it in the urine. Tapping it is not enough, you have to really soak it in it. And it's just amazing on how it can start healing.
I used to have a very bad acne problems when I was teenager, and so what I did was I collect the urine and I wash my face all the time for about 2 to 3 weeks. And after that, I saw my face so clear, and I felt so much in harmony with the universe. It was really beautiful.
To urinate on a wound and with a gauze sounds logical in the sense of the physiologic saline, the pH of the material that you're working with, and the fact that urine, when it does come out, is sterile, and that actually would help the wound at some point.
外用するということは、体中に張り巡らされた知覚神経ですね、痛みを感じるとか、そういう知覚神経に対してどういう影響を及ぼすかということについては、確かに病気を治す、皮膚病を治したり痛みを取ったりする力はあるんですが、何のためにそういうように効くかということについては、これからの研究に待つわけなんです。
When a person has an advanced skin condition, when they have psoriasis, when they have eczema, or any type of irritation, then let the urine sit for 3 days and apply all the urine on the skin.
It's very possible that as soon as the urine leaves the body, it's very rapidly susceptible to creation of growth and things of that sort. So using it at a later date and using it topically on compromised skin could lead to both topical infections as well as possibly even systemic infections.
We associate often the taste and smell of urine with what we have smelled somewhere on a public toilet, and that's old urine. And in old urine, ammonia develops, and that stinks. But in fresh, completely fresh urine, there's no ammonia, and it actually usually doesn't taste as bad as people think.
Urine inside the body is sterile, but left outside the body for some period of time becomes a growth medium for bacteria. And one of the most nutritious substances in the urine, from the microorganism point of view, is urea. They use urea as a source of energy. They break down that urea, and when urea is broken down, it breaks down to ammonia.
Urea, or also carbamide, which it's also known as, is urine. And it's got some tremendous benefits to the body. This is an example of urea, and this is an FCC grade, which is a food grade urea, so this would be acceptable for human consumption. It's like a little crystal.
The urea that's in most skincare products is actually synthesized. It's called carbamide, and that material is put into lotions, ointments, gels, creams to condition skin and to improve the ability of the skin to retain moisture.
If you go to some of the higher end retail stores, you'll find that all of their high-end cosmetics have urea in them. And that's because urea binds with hydrogen and traps moisture into the horny layer of the skin. And it is the only thing that'll do that. So as a humectant, it's excellent.
There is an aspect of skincare that is moisturization, of which urea does that by helping the skin cells bind together and do their job. But then in higher concentrations, in exfoliation to get the dead skin cells off, urea glycolic acid then functions as an exfoliant. So depending on its concentration, urea, much like alpha hydroxy acids, have two functions in skincare depending on what you want them to do.
Moisturization of the skin comes from underneath, not from on top. So our aim is to get a product that goes through the skin into the deep levels and then brings it forward, moisturizing. And the urea products produced under the Carmel name do exactly that.
If you have compromised or damaged skin, your body actually goes about enzymatically trying to repair that damage. And with urea, it actually comes in and it can function as a bacteriostatic material, well-known bacteriostatic property. It's been used in wound debridement agents for a number of years, prescription and non-prescription.
Try to sell a 10% urea product or a 5% urea product that does pretty much the same thing as alpha hydroxy acids, and it loses all its allure to a consumer looking to make their skin look better. You want me to use what on my skin?
Just by the low viscosity nature of urine, you're talking it's going to be all over the place. I mean, it's very hard unless you have a gauze or some way to keep it in contact with the area that you need to really get the job done.
The urea that we use in our products are are chemicals that are prepared at a factory and then shipped to us in bulk, and then we put it together with moisturizers. It is not from naturally occurring urine, which it could be because of the inability to get standardized material.
Urea has been used to treat cancer, high blood pressure, asthma, you name it. Every known disease has been treated with urea.
I had a nasty case of shingles. It was right around my side, and I was freaked out. I took a cup, I filled it up, what I found out later was about 7 ounces of urine. And I looked at it and I said, this is the craziest thing I've ever done. And I just banged it all down, just like a beer. And it surprised me. All it tasted was like warm seawater. And I said, this isn't so bad. I expected to be dead in 15 minutes. Well, in 15 minutes, I had this nice rise in energy. And the next day, a cold I had developed was gone. The pain had subsided somewhat, didn't totally go away. 2 days later, the pain was down a good 75%. And I says, hey, I'm onto something. This is interesting. 3 days later, it was totally gone.
It's not dose sensitive, so some people feel, oh, I have to drink the more the better. It's not true. You can drink a couple of ounces a day.
You can recycle all the urine produced by the body on a daily basis, and nothing will happen.
When you begin to take the urine therapy initially, you'll have a reaction, maybe for 3 months, for 6 months, for a year, depending on your body. Because at the beginning, there's a cleansing that goes on in your body. And a lot of people suffer headaches, others have diarrhea, others get kind of dizzy. Depending on the type of sickness that you have, the illness that you have, the cleansing goes on for several months.
I'm a singer and I do a lot of cabaret nightclub, and I detest it because I don't believe in drinking, smoking, all that sort of thing. But so many times when I leave the club, I mean, I'm so full of cigarette smoke, my clothes, my insides, I just feel it in my eyes. I can hardly breathe, it's like wheezing. I get home, I drink my urine, and it's gone. I can't begin to tell you the energy that I got, the glow that I got. I had my 45th birthday last week.
I had some athlete's feet. That had gone away after I started drinking the urine. It took about a month and a half. And I remember when I had it, I thought, oh, well, this is it. I'm going to have athlete's feet for the rest of my life because my father had it, my older brother had it. But I don't have it anymore. I haven't had it in over 6 years.
There are people who are on nicotine that have started urine therapy, and alcoholics that have gotten off of the alcohol and nicotine from drinking their urine. We seem to be attracted to things that we're allergic to. So when you inject the urine back into the body, these allergic reactions that the body has been going through with all these substances that we put in them gets handled, and then the desire leaves.
One of the effects of urine is that it seems to initiate an appetite or maintain an appetite. We now know that there's a compound in urine called phenylacetylglycine that is being touted as the component that is responsible for stimulating the appetite centrally, that is in the brain.
There are quite a lot of ways you can use urine therapy internally. That starts by drinking, just from homeopathic and a few drops up till drinking all of it. Then you can also use it as drops for ears and eyes.
With sinuses, you have to sniff it up into your sinuses in order for it to really soften out whatever is in there.
Cuando voy a alguna parte que no lleve mi vasito, si me duele la cabeza, aunque sea con la mano y... ¿Sí? Yo me capeo con la mano y... Hasta acá. Se me quita el dolor de cabeza. Empiezo a sentir que se me escombra, se me quita esto mormado de aquí. Y también y así.
You can take urine and boil it and breathe the vapors. That clears up your lungs so fast, you have no idea how effective it is. And it costs you nothing. The only thing is that your house may smell a little bit.
You can use it as a vaginal douche, as enemas. I always recommend enemas to anybody who's dealing with a severe disease. The first thing you do is start collecting your urine. And we're not talking a couple of ounces here. We're talking about getting a good enema bag that is somewhat like a douche bag,
and filling that 2-3 quarts and get that in there. And then you watch, your skin will start to glow after you do this enough.
Frequent taking of urine enemas could have disadvantages, could cause urea breakdown to ammonia, which would irritate the colon and induce an inflammatory diarrhea, and also done over many years might increase a predisposition to colon cancer.
If a person's having a heart attack, they're releasing the enzyme called urokinase, and if they take a tablespoon or half an ounce of their auto urine, has to be your own, and put it under the tongue, it's 3 times more powerful than a nitroglycerin tablet.
A person my size would need 4 to 5 million units of urokinase if I had a myocardial infarction and I was in an EMS thing and they were taking me to the ER room. I have to get it within a certain amount of time. Now let's go back to what does it take to produce this protein? In order to get 27 million units of purified urokinase, you have to have 1,000 gallons of urine. So you and I could void our own urine until our eyeballs crossed.
The urokinase, under normal circumstances, has to be injected in a person's vein because it's a protein that you drink. It's going to be denatured in your in your gut, in your bowels. So that if I swallowed the same urokinase for a stroke, it's not going to have any effect. And number 2, even if somebody stretched the issue and said, well, maybe it has some effect, maybe a fraction of it is going in, I personally will have it as a tablet rather than drink up the urine. I mean, that's I guess, it's a personal belief and preference.
They don't have any scientific basis, and they never put their products up to scrutiny, their concept up to scrutiny.
We're always concerned, how does it work and all that stuff. We don't know how an aspirin works, and yet it's still legalized. You can buy it in any drugstore.
Before I even went to medical school, I heard about people drinking urine. I always thought it was kind of disgusting, but I don't know how to evaluate it. Who knows?
You shouldn't be scared to touch your own urine. This is your own part. This is natural from you.
I don't think there is a danger in ingesting one's own urine if you are a healthy person.
During the day, as you eat, as you take in food, the whole constitution of urine changes. Therefore, it depends on what stage of the urine people are talking about. We have to be very careful to give this to people before we have tested in a controlled setting and make sure they don't have toxicity in different conditions such as cancer, pregnancy, and many different. For all we know, if you start to use this in a general population, young people may take it. It may retard growth, it may cause thyroid problems, endocrine problems, so it has to be done in a controlled setting. And if it's efficacious, I have no problem to use that as a modality for treatment.
I have tasted urine as a kidney specialist. I prefer alternative beverages of similar color.
Some people like it and some people don't. But you see, when you're very sick and you're very ill, you might not like the taste. But if you know you're gonna die, you will drink it.
To your health. My urine just brewed earlier.
I don't wanna tread in your deep water. I don't wanna sink in you.
I think some of the strangest things that I've experienced is probably the most odd would be urine therapy.
I heard it on the radio once or something that Madonna pees in the shower so that she prevents athlete's foot or something. I've heard of people, if they got bit by a sort of sea urchin, to pee on their foot. I think it was actually on an episode of Friends, yeah.
The Friends, where she got bit by a jellyfish and she had to pee on her leg to take the sting away. Did you see that one?
No.
It's very funny.
Okay.
But it worked.
So someone must have told her about it, I guess.
Joey watches the Discovery Channel.
I've heard of people using it for sexual purposes, but therapeutic, no.
They drink their urine.